Let's learn about BPH in a simple way. So, what is BPH? You need to know that BPH is a benign prostate hyperplasia. It is mainly caused due to enlargement of a prostate gland. So now let's learn about the causes. So, what are the causes of BPH? You guys can comment down below. The main causes of BPH are smoking, that is the primary causes of BPH, and other options are reduce in any kind of physical activities is also another cause of BPH. Similarly, another most important factor that causes prostate enlargement is due to Western diet. So do not forget about this. Now let's learn about the clinical features of BPH. So what are the common clinical features that are often seen in BPH? The main symptoms are urinary frequency, urinary urgency, increase in urination during the night time. It is also called as nocturia. So these are the main characteristics features of BPH, and other symptoms are dribbling urination and straining of urine. So always remember FON-DS. It is a mnemonics which will help you to remember the clinical features of BPH. So now let's learn about the diagnostic test. What are the most important diagnostic tests that are usually done in BPH? So remember about digital rectal examination, also known as DRE. It is most commonly done in order to diagnose or in order to know about the BPH. So the digital rectal examination shows large, rubbery and non-tender prostate in case of BPH. Similarly, other main diagnostic tests that are commonly done in order to diagnose or in order to check whether the patient have BPH or not are urine analysis. Urine analysis is also main testing which is done in case of BPH. Similarly, urine culture and other tests like blood, urea, nitrogen and creatinine in order to check our kidney function test. And the most important and specific one is about PSA antigen. The normal value of PSA is 2.5. So remember, normal PSA is from 0 to 2.5. So it may be different in different conditions, like it may be different in different age group. Always remember that. Now let's learn about medical management. What are the most important medical management which are normally done in case of BPH? Remember, our main problem and our main intention is to solve urinary problem. So most frequently catheterization is done in most of the patient. Similarly, another intervention is normally operation is carried out, the procedure is carried out which is known as cystostomy. And in exam this question is most frequently asked. So normally people who have BPH tend to use herbal medication, and that commonly used herbal medication is also known as saw palmetto, which is most frequently and most commonly used in this case. And as we know, saw palmetto has minimal side effect as well as complication. Now let's learn about the medication, different types of medication which are used in case of BPH. Remember about alpha blockers. So what are the alpha blockers? So remember about this medicine known as tamsulosin, and another one is silodosin. Similarly, there are more medicine which are commonly used in BPH. It is also known as finasteride, which is most commonly asked during your NCLEX examination. So always remember, finasteride is usually used in case of BPH. And another one, the most commonly used drugs is also known as tadalafil. Tadalafil is especially used in case of enlarged prostate. It helps to reduce the prostate gland. Now let's learn about the surgical management of BPH. So what are the most common surgical management which is normally done in case of BPH? Remember TURP. Always study about its post-operative and pre-operative interventions that we must know as a nurse. Similarly, other management like TUNA, heat treatment, and similarly prostatectomy is done in surgical management. Now let's learn about the nursing management, that is nursing consideration in case of BPH. So always remember our main problem is about urine and urinary retention. So our target is to increase the amount of fluid, that is we must prescribe patient or we must let the client consume 2 to 3 liter per day fluid until and unless it is contraindicated. So number 2, always remember that we need to prepare the client for catheterization in order to facilitate urinary drainage as well as promote urinary retention and as a process of treatment and to treat any kind of distension. So, another most important nursing management that we must learn about BPH is about the certain medication that we must avoid in case of BPH patient. So, those medications that we need to avoid in case of BPH are normally antihistamine, anticholinergic, and the last one is decongestant along with antidepressant. So remember about these four medication that must be avoided in case of BPH patient. Always remember that we need to avoid any kind of acidic food or that food which contain caffeine or caffeinated products. So it should be avoided in every case. Furthermore, other nursing consideration that we must know is always make a schedule timetable in order to prepare the client for boarding. It's all about BPH. Stay updated for more tips and tricks and comment below for any kind of concern or queries.